The topic of my presentation is correlation of Apgar scoring and retinopathy of prematurity. Retinopathy of prematurity is a vasoproliferative retinopathy that affects the developing retinal vessels of premature infants. It's a main cause of visual impairment in premature infants, though it is considered as a multifactorial disease. But the immaturity of vascularization is the key factor that causes the increased susceptibility of retina to the oxidative damage and to a number of perinatal factors. Few words about Apgar score. It's an accepted and convenient method for reporting the status of newborn infant immediately after birth and the response to resuscitation if needed. This test is generally done at 1 and 5 minutes after birth and may be reported later if the score is and remains low. Apgar test purpose is to determine quickly whether a newborn needs immediate medical care, though it is not designed to predict long-term health issues. It's a chart showing the Apgar scoring system. Less than 7 is generally considered as depressed and more than 7 is an excellent. It was a hospital-based observational cross-sectional study where we included infants with less than 32 weeks of gestational age and the infants with major congenital abnormalities preventing good assessment of fundus, and premature infants born at home or in other hospitals and transferred after birth were excluded. The patient fitting into the inclusion criteria was selected from the neonatal ICU of the Department of Pediatrics and screened for ROP. A total of 107 newborn infants were screened. The fundus examination was performed using indirect ophthalmoscope and a 20D lens with speculum and scleral depression after pupillary dilatation using 2.5% phenylephrine and 0.5% tropicamide eye drops. Screening was done according to the criteria laid down by the American Academy of Pediatrics and Ophthalmology. The first examination was performed between 3 to 4 weeks of postnatal age. Retinopathy was graded into stages and zones as per international classification of ROP. Gestation age, weight, and Apgar at 1 and 5 minutes were recorded. A total of 107 infants were screened, out of which retinopathy was present in 25 cases. It's a age distribution in cases diagnosed with ROP where maximum number of cases were in the age group of less than 28 weeks. And it was statistically significant. The birth weight distribution, maximum number of cases were in the birth weight of 1000 to 1200 grams. And the low birth weight was statistically significantly associated with occurrence of ROP. The mean Apgar score at 1 minute was 4.16 as compared to 6.48 of the cases where ROP was absent, and at 5 minutes it was 5.52 as compared to the 7.01 of the cases where ROP was absent, and this was statistically significant. To conclude, low Apgar score at 1 and 5 minutes is significantly associated with the occurrence of ROP. Apgar score must be recorded for every newborn and necessary information should be provided accordingly. Thank you.
It's very reasonable to think that low Apgar and prematurity, ROP is associated. It's well taken.
Dr. Dogra, any comment? Yeah.
Yes, sir.
Thank you. Thank you.
Thank you, sir.
The next presenter